Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Hey everyone, and welcome to this deep dive on Alzheimer's disease. We're going to be taking a look at the research you've given us and hopefully getting to some of the key takeaways about this really complex topic.
Yeah, definitely a complex topic, a lot to unpack here. We'll be looking at, the definition, how it affects the brain, risk factors, symptoms, and even touch on some of the new treatments that are emerging.
Yeah, that's right. And one of the first things that really jumped out at me from the research was just how prevalent Alzheimer's disease is. It actually accounts for a staggering 60 to 80% of all dementia cases.
Yeah.
That's a majority. So we're not just talking about, typical aging here.
Absolutely not. No, this is something distinct and unfortunately quite devastating. And when we look at what's happening in the brain with Alzheimer's, there are two hallmarks that really stand out: amyloid plaques and tau tangles.
Okay, so we hear these terms a lot: amyloid plaques, tau tangles. Can you break those down for us, what's actually going on at that microscopic level?
Yeah, so imagine your brain as a bustling city with lots of activity, buildings and roads and communication lines. Amyloid plaques, you can think of those as like roadblocks disrupting traffic flow, causing communication breakdown between those brain cells, those buildings in our city analogy. These plaques are basically clumps of protein that shouldn't be there. And they also trigger this harmful inflammation, which further disrupts the city's operations.
Okay, so we've got these traffic jams, essentially, between the brain cells. What about those tau tangles? Where do they fit into this city picture?
Yeah, well, if amyloid plaques are the traffic jams, tau tangles are like the buildings themselves starting to crumble from the inside. So tau protein is normally there to provide structural support for neurons, kind of like the scaffolding or internal framework of those buildings. But in Alzheimer's, it twists into these tangled messes, and it blocks the transport of nutrients, essentially choking off the buildings from within.
So we've got traffic jams between the buildings, and the buildings themselves are collapsing. No wonder things start to go wrong.
Exactly, yeah. It's a recipe for disaster.
And the research also lists several specific brain regions that are particularly vulnerable in Alzheimer's.
Right.
Which ones would you say are most crucial for our listener to understand?
Okay, so there are three key areas I'd like to highlight. First, the hippocampus. This is like our brain's memory center, and it's an early target in Alzheimer's. This explains why memory loss, especially for recent events, is often one of the first noticeable symptoms.
Okay, so it makes sense if the memory center is being hit first, that's one of the first things people notice.
Yeah, exactly. Think about those times you walk into a room and you completely forget why you went there. That's your hippocampus at work. Now imagine that happening much more frequently and for more significant events.
Right.
That's the reality for people with Alzheimer's.
That's a really relatable way to explain it, actually.
Yeah, and then as the disease progresses, it starts to affect the cerebral cortex, which is responsible for our higher level thinking, decision-making language, all those things that make us us. Damage here leads to confusion, impaired judgment difficulty with those more complex tasks.
So it's not just memory loss, it's affecting our ability to think, process information, and interact with the world around us.
Exactly. It starts to really impact daily life.
And what was the third area you wanted to highlight?
Right. The third one is the amygdala, which governs our emotions.
Oh.
Damage to this area contributes to the mood swings, anxiety, and emotional instability often seen in Alzheimer's. And this can be one of the most difficult aspects for both the individual and their loved ones to cope with.
It sounds like Alzheimer's really does chip away at a person's core being. It's a scary thought. So we've talked about what's happening in the brain, these different areas that are affected. But the big question is why? Why is all this damage happening? What's triggering this cascade of events in the brain?
That is the million-dollar question, and unfortunately, there's no simple answer. The exact cause of Alzheimer's is still a mystery. It's a puzzle that scientists are working tirelessly to solve.
So much research going on, but still so much we don't know.
Yeah, and that can be frustrating for people who are looking for answers, but we do know that those amyloid plaques and tau tangles are key players in this whole process. But there's also evidence of neurotransmitter imbalances, chronic inflammation, vascular problems, even oxidative stress. It's like a domino effect, one problem triggering another.
So it's not just one culprit. It's this whole gang of factors working together to wreak havoc in the brain.
Yeah, that's a good way to put it.
It's a little overwhelming to think about all these different factors that could be at play. But it makes me wonder, are there any risk factors for Alzheimer's that we can actually control? I know the research mentioned a few.
Absolutely, yes. While age is the biggest risk factor,
Yeah.
and unfortunately we can't stop the clock, there are things we can do to potentially lower our risk or delay the onset of the disease.
Okay, so give us a sense of agency here. What are some things we can actually do?
Well, heart health is a major one. High blood pressure, diabetes, obesity, high cholesterol, all of these increase the risk of Alzheimer's.
And so those things that we always hear about for overall health are also crucial for brain health.
Exactly. It highlights the importance of healthy lifestyle. Regular exercise, a balanced diet, not smoking, all these things play a role.
So those healthy habits we hear about all the time actually have a direct impact on our brain health too. It's not just about looking good, it's about protecting our cognitive function.
Precisely. And here's another interesting one. The research mentioned a connection between sleep and Alzheimer's risk.
Oh, really?
Yeah, chronic sleep problems, whether it's sleep apnea or just consistently poor sleep, can actually increase your risk. Seems like our brains need that downtime to clear out waste products and repair themselves.
Okay, I'm definitely going to be prioritizing my sleep from now on.
It's amazing how all these seemingly unrelated things can actually impact our brain health.
It really is. It's all connected. So
Right.
we've got these risk factors, and then the research talked about the different stages of Alzheimer's, which it's helpful to break it down, but it's also a bit overwhelming to think about all the different stages. So what are some of the key takeaways our listeners should focus on here?
Well, first and foremost, it's important to remember that everyone's experience with Alzheimer's is unique, and the progression through these stages can vary quite a bit. Early diagnosis is crucial, though, because it allows for those earlier interventions and potentially slowing down the disease's progression.
Early diagnosis is key.
Got it. Yeah, and the research mentioned a preclinical stage, where changes are happening in the brain even before symptoms appear.
So it's happening even before we're aware of it.
Exactly. And then there's mild cognitive impairment, or MCI, where people experience subtle memory lapses or difficulties with thinking that are more frequent or noticeable than typical age-related changes. Not everyone with MCI will develop Alzheimer's, but it's definitely a risk factor.
So those senior moments we all joke about could actually be a sign of something more serious.
Yeah, it's something to pay attention to, for sure.
It makes you think twice about brushing them off.
Yeah.
And then what happens after the MCI stage?
Well, after MCI, we move into the three main stages of Alzheimer's: early, middle, and late.
Okay, so walk us through those. What are some of the hallmarks of each stage?
In the early stage, memory problems become more noticeable. People might forget names, recent events, or have difficulty finding the right words. Planning, organizing, making decisions also become more challenging. And we might also see mood changes like anxiety or irritability.
So everyday life starts to become more difficult as the disease progresses.
Yeah, and then in the middle stage, those memory problems worsen. And people start having trouble with daily tasks, like managing finances, cooking, or dressing themselves. Confusion and disorientation become more common, even in familiar environments.
It's like their world is slowly shrinking as their cognitive abilities decline.
And then the late stage, unfortunately, is the most severe, characterized by profound memory loss to the point where individuals may not even recognize loved ones. Communication becomes severely impaired, and they may lose the ability to walk or even swallow. At this stage, individuals require 247 care. It's a heart-wrenching reality for families to face.
It sounds like the journey through Alzheimer's is incredibly difficult, both for the individual and their loved ones. And this brings us to another crucial question. How is Alzheimer's actually diagnosed? The research mentioned that there's no single test, which I've found a bit unsettling.
Yeah, it's true. Diagnosing Alzheimer's can be a complex process. It's not like a simple blood test or anything like that. Doctors use a combination of methods to really piece together the puzzle.
So what are some of those methods?
Well, cognitive tests are used to assess memory, reasoning, and problem-solving skills. Brain imaging, like MRI or PE scans, can detect brain shrinkage and other changes characteristic of the disease. And there are newer biomarker tests that examine blood or spinal fluid for specific indicators of Alzheimer's.
So it's a multifaceted approach, gathering clues from different sources to get the full picture.
Exactly.
Speaking of the full picture, let's move on to treatment options. There's no cure for Alzheimer's yet, but there are ways to manage symptoms and potentially slow down the disease's progression, right?
Absolutely. While we're still searching for a cure, there are treatments that can offer some relief and improve quality of life for individuals with Alzheimer's.
Well, that's good to hear. What are some of the most promising treatments available right now?
Well, there are a few key types of medications that are used. Cholinesterase inhibitors work by boosting levels of acetylcholine, which is a neurotransmitter that's crucial for memory and learning.
Okay.
And then there are NMDA receptor antagonists, which help regulate glutamate, another neurotransmitter involved in learning and memory. These medications are particularly helpful for moderate to severe Alzheimer's.
So they're targeting those brain chemicals that are essential for cognitive function. What about those newer therapies mentioned in the research, the ones that target amyloid plaques directly?
Ah, yes. Those are called monoclonal antibodies, and they represent a really exciting new frontier in Alzheimer's treatment.
Okay.
These drugs like aducanumab and lecanemab are designed to clear out those amyloid plaques from the brain. Think of them as specialized cleanup crews targeting those traffic jams we talked about earlier.
Right.
There's a lot of hope riding on these monoclonal antibodies, and while they're not a cure, they could potentially slow down the disease's progression.
So it's not all doom and gloom. There are some promising developments on the horizon.
Exactly. There's reason for hope.
But the research also emphasized the importance of non-drug approaches as well.
Yes, absolutely.
Can you tell us more about those?
Of course. So even with medications, those non-drug approaches are essential for managing Alzheimer's and improving quality of life. One of the key ones is cognitive therapy, which involves brain exercises and activities designed to enhance memory and problem-solving skills. It's like giving your brain a good workout, keeping those neural pathways active and engaged.
That's interesting. So mental stimulation can help build cognitive reserve,
Right.
even if it can't reverse the damage that's already been done.
That's the idea, is like building a stronger foundation for your brain to withstand the challenges of aging and disease.
It makes sense. What other non-drug approaches are there?
Well, physical activity is incredibly important. It not only improves overall health, but also boosts brain function and reduces inflammation. Think of it this way. Exercise helps deliver more oxygen and nutrients to your brain, which is like giving those city streets a much-needed upgrade.
Okay, I like that analogy.
And then there's social engagement, which is crucial for maintaining cognitive function and emotional well-being. Staying connected with others through social activities, hobbies, or even just regular conversations can make a big difference. It helps combat the isolation that often accompanies Alzheimer's.
It sounds like taking a holistic approach is key, focusing on both medical treatments and lifestyle changes.
Absolutely.
This is all incredibly valuable information, but we're just getting started. We'll continue our deep dive into Alzheimer's in just a moment, exploring what this all means for patients and caregivers. Stay with us.
Welcome back to our deep dive on Alzheimer's disease.
So before the break, we were talking about those non-drug approaches, things like cognitive therapy, physical activity, and social engagement. And you mentioned how important those are alongside medical treatments. But I'm wondering how they actually translate to daily life for someone living with Alzheimer's. Can you give us some concrete examples?
Yeah, absolutely. So for someone diagnosed with Alzheimer's, staying mentally engaged is really paramount. This doesn't have to be anything complicated. We're talking about reading, doing puzzles, listening to music, pursuing creative hobbies, anything that keeps those neural pathways firing.
So it's about challenging your brain and keeping it active rather than letting it passively decline.
Precisely. And simple memory aids can be incredibly helpful as well. Things like calendars, reminder notes, or even smartphone apps can make managing daily tasks much less stressful and more successful.
It's about adapting to the challenges of the disease and using tools to maintain independence for as long as possible.
Exactly. And of course, a healthy diet and regular exercise remain crucial for overall well-being, both physical and mental. Remember that exercise we talked about earlier? It not only delivers oxygen and nutrients to the brain, but it also stimulates the growth of new brain cells.
It's amazing how interconnected everything is. Those healthy habits we often hear about really do have a ripple effect throughout our bodies, including our brains.
They really do. And speaking of interconnectedness, I want to shift gears a bit and talk about the vital role of caregivers in this whole journey.
Yeah, caregivers are so essential.
It's an incredibly demanding role, both physically and emotionally.
Absolutely. What are some of the most important things caregivers can do to support their loved ones?
Well, creating a safe and supportive home environment is paramount. This might involve removing potential hazards, installing grab bars in the bathroom, or simplifying the living space to reduce confusion.
It's about anticipating the challenges that might arise as the disease progresses and making adjustments to the environment proactively.
Yes, precisely, and communication is key. But it can become increasingly difficult as Alzheimer's progresses. Using clear, simple language, speaking slowly and patiently, and offering reassurance and support can go a long way.
It's like stepping into their world and meeting them where they are, rather than trying to force them to conform to our reality.
Exactly. And it's also important to remember that nonverbal communication, touch, eye contact, those things can still convey a lot of meaning, even when words fail.
It's about connecting on a deeper level beyond the limitations of language. The research also mentioned long-term care options, which I imagine become necessary for many families at some point.
You're right. As Alzheimer's progresses, the demands on caregivers can become overwhelming, and that's where long-term care options come in. In-home caregivers can provide assistance with daily tasks, while assisted living facilities offer a more structured environment with professional medical care available. And for those in the later stages of the disease, hospice care provides compassionate end-of-life support.
It's comforting to know that there are different levels of care available to meet the changing needs of both patients and their families. Before we move on, I wanted to circle back to the connection between diet and brain health. It really struck me in the research. Could you elaborate on that a bit more?
Absolutely. What we eat has a profound impact on our brain health. Certain foods can actually help prevent cognitive decline and may even slow the progression of Alzheimer's.
So what are the brain-boosting superstars we should be adding to our grocery lists?
Well, some of the key players include omega-3 fatty acids, found in oily fish like salmon and mackerel, as well as flax seeds and walnuts. These healthy fats support brain function and may help protect against cognitive decline.
Okay, fish oil, got it. What else?
Antioxidant-rich foods are also crucial. Colorful fruits and vegetables like berries, leafy greens, and broccoli. Antioxidants help protect our cells from damage caused by free radicals, those unstable molecules that can wreak havoc in the brain.
So eating the rainbow is not only good for our bodies, but for our brains too.
Exactly. And then whole grains like brown rice, oats, and quinoa are great for maintaining steady energy levels for our brains. And don't forget nuts and seeds, they're packed with essential vitamins and minerals that support cognitive health.
It sounds like a Mediterranean-style diet, with its emphasis on fruits, veggies, whole grains, and healthy fats. Is a winning strategy for brain health?
It certainly seems that way, and what's fascinating is that these dietary changes aren't just about preventing Alzheimer's. They can benefit our cognitive function at any age. It's never too early or too late to start nourishing our brains.
That's an empowering message. We have more control over our brain health than we might realize.
Yeah.
But I imagine there's still a lot of unknowns when it comes to Alzheimer's. What's the current state of research? Is there reason to be hopeful?
Absolutely. There is research in the field of Alzheimer's is rapidly advancing. New therapies are being developed. Our understanding of the disease is constantly evolving. There's a lot of hope on the horizon. Just in the past few years, we've seen the approval of those monoclonal antibodies we discussed earlier, and there are many more promising treatments in the pipeline.
So while there's no cure yet, we're making progress. It's not a stagnant field,
Yeah.
but one that's constantly pushing forward.
Exactly. And that's what I want to emphasize for our listener. This deep dive is just a snapshot in time. The field of Alzheimer's research is dynamic and ever-changing. New discoveries are being made all the time.
So it's a call to stay curious, stay engaged, and stay hopeful. There's still so much to learn and discover. We've covered a lot of ground in this deep dive, from the cellular changes in the brain to the latest treatment options and the crucial role of lifestyle factors. But where do we go from here? What are the key takeaways for our listener as they continue to explore this complex and often challenging disease?
Well, I think the most important takeaway is that knowledge is power. The more we understand about this complex disease, the better equipped we are to make informed decisions about prevention care and treatment for ourselves and our loved ones. This deep dive is just a starting point. I encourage our listener to stay curious, seek out reliable sources of information, and engage in ongoing learning about Alzheimer's.
It's a call to action, to stay informed, stay engaged, and stay hopeful.
Exactly, because in the face of a disease as complex as Alzheimer's, knowledge is our most powerful tool. It allows us to advocate for ourselves, our loved ones, and for continued research that will hopefully lead us closer to a cure.
That's a perfect note to end on. A reminder that even in the face of a complex and challenging disease, there's always hope, and there's always more to learn. Thanks for joining us on this deep dive.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.